Hello YouTube. Hello everybody. This is Dr. Tehania Isa. I work as a professor of pathology in a medical college. I make these videos for my students and for any medical student. Hope someone may find it helpful. We're still talking about cellular adaptation. We'll talk today about metaplasia. First, we will have to review some slides, only one or two slides. We said before that homeostasis means steady state maintained by the cell to be able to function. We said that the normal cell is confined to a fairly narrow range of function and structure by its state of metabolism, differentiation, and specialization, and by the constraints of the neighboring cells, and by the availability of the metabolic substrates. It is thus able to handle physiologic demands, maintaining a steady state called homeostasis. If the cell is subjected to increased stress, the cell is active participant. It has to change its structure or function to maintain another steady state different from the previous steady state to be able to withstand the stress and to be able to function and survive. And we call this new state adaptation. So adaptation is reversible, and we said reversible because if the stress is eliminated, the cell can return back to the previous steady state, the normal one. So adaptation is reversible functional and structural responses to more severe physiologic stress and some pathologic stimuli, during which new but altered steady states are achieved, allowing the cell to survive and to function. This means that the cell may change or may adapt by increasing its size, and we call this hypertrophy, and we discussed hypertrophy before. Or the cell may adapt by decreasing its size or number, and we call this atrophy. The cell may adapt by increasing its number, and we call this hyperplasia. Now we are going to talk about different types of adaptation in which the cell changes its structure, its shape, and we call this metaplasia. So metaplasia can be defined as a reversible change in which one differentiated cell type, maybe epithelial or mesenchymal, is replaced by another differentiated cell type. So the definition of metaplasia is reversible. Reversible because if the stress is eliminated, the cell can go back to its original state. A reversible change in which one differentiated cell type, maybe epithelial or mesenchymal, is replaced by another differentiated cell type. This means that one adult cell may change to another adult cell, differentiated cell. So this is because this cell type may be subjected to a particular stress. And this particular stress, the cell cannot withstand it. So it has to change to another type to be able to do its function and to survive. So the cell may change, for example, from columnar epithelium to squamous epithelium, or from squamous to columnar, or from transitional to squamous. This represents an adaptive substitution of cells that are sensitive to stress by cell types better able to withstand the adverse environment. Metaplasia may involve the epithelium, so we call it epithelial metaplasia, or may be mesenchymal, and we call it mesenchymal metaplasia. So it may be epithelial metaplasia or mesenchymal metaplasia. The most common is the epithelial metaplasia. Epithelial metaplasia means the change of one type of epithelium to another type. Most commonly, the other types of epithelium change to squamous in the majority of cases. The differentiated fragile epithelium like columnar epithelium usually change by metaplasia to squamous. The transitional epithelium may also change to squamous because squamous epithelium is more resistant. So when I say squamous metaplasia means that another epithelium changed to squamous. When I say columnar metaplasia, it means that the epithelium wasn't columnar, but it changed to columnar. So the most common form of epithelial metaplasia is the squamous metaplasia. Example of squamous metaplasia occurs during chronic inflammation of the trachea and bronchi in cigarette smokers. Here you know that the respiratory system, trachea and bronchi, are lined by respiratory epithelium, which is pseudostratified ciliated columnar epithelium. This epithelium can't stand the irritation by the cigarette smoke, and it has to change to another resistant one, another more resistant one, able to withstand this stress, which is the stratified squamous epithelium. This is squamous metaplasia of respiratory epithelium. Here's the ciliated columnar epithelium. Here is the ciliated columnar epithelium. Change it here into squamous. This is the respiratory epithelium in a cigarette smoker. And this is the ciliated, pseudostratified ciliated columnar epithelium. You can see here, pseudostratified, and here is the cilia. And here it is changed to squamous epithelium. Another cause for change of the respiratory epithelium to squamous is the deficiency of vitamin A, retinoic acid. This also causes squamous metaplasia of the respiratory epithelium. Another cases of squamous metaplasia is chronic cholycyctitis, in which the gallbladder wall change from columnar epithelium to squamous epithelium. Other examples of squamous metaplasia is the urinary bladder. Urinary bladder is lined by transitional epithelium, and in cases of bilharziasis, due to constant inflammation and irritation, the epithelium changes from transitional to squamous, and we call this squamous metaplasia. Also, the endocervical mucosa in chronic cervicitis. The endocervical mucosa is lined by columnar epithelium, sometimes change into squamous in cases of chronic cervicitis, which is inflammation of the cervix. Stone in the excretory ducts of the salivary glands, pancreas, or bile ducts may also cause replacement of the normal secretory columnar epithelium to change it into stratified squamous epithelium. But epithelial metaplasia is a double-edged sword. This means that the change from transitional or from columnar epithelium into squamous, this comes with a price. For example, in the respiratory tract, although the respiratory lining change from the weak, fragile columnar epithelium to more strong stratified squamous epithelium, important mechanisms of protection are lost. We have important protection mechanisms in the pseudostratified ciliated columnar epithelium. We have we have important mechanisms to give protection against infection, such as mucus secretion and the ciliary action of the columnar epithelium. These are lost. And so we can say that epithelial metaplasia is a double-edged sword, and in most cases it represents undesirable change. And if the stress persists, it may predispose to malignancy in the areas of squamous metaplasia. And this occurs in the respiratory tract. The squamous metaplasia in the trachea and bronchi in the respiratory epithelium may predispose to squamous cell carcinoma. And also in the urinary bladder, in cases of bilharziasis, the squamous metaplasia may also progress to squamous cell carcinoma. The other type of metaplasia is glandular metaplasia or columnar metaplasia. We have a common type of glandular metaplasia. We call it intestinal metaplasia, which occur in the esophagus, in the lower third of esophagus, due to acid reflux, in cases of acid reflux. Here is the esophagus. We have a case of intestinal metaplasia, and this is part of the esophageal mucosa. This is the squamous epithelium of the esophagus, and here it is changed into columnar. It becomes a columnar, forming a glandular-like structure, intestinal-like glands. This is intestinal metaplasia. This usually occurs due to acid reflux in the lower third of esophagus. This is because the stratified squamous epithelium of the esophagus can't deal with the acid. So it has to be changed to something can deal with the acid, as may be gastric or intestinal. So this may be gastric mucosa. Sometimes it is changed to gastric mucosa or to intestinal mucosa, and we call it intestinal metaplasia. Another type of glandular metaplasia or intestinal metaplasia occur in cases of peptic ulcer. The gastric epithelium may change to intestinal type of epithelium with villi like that of the intestine, and we call this intestinal metaplasia. Another type is the serous, or another type of glandular metaplasia, serous or mucinous metaplasia. It occurs in the germinal epithelium of the ovary. Metaplasia may be mesenchymal. Mesenchymal metaplasia means that the fibroblast may change into chondroblast or osteoblast, and we may find cartilage or bone in tissues normally not contain these elements. And this usually occurs due to injury, cell injury, or maybe in tumors. And you will hear about myositis ossificans. Myositis ossificans sometimes mentioned as a type of mesenchymal metaplasia. But in fact, myositis ossificans occur in areas of hemorrhage in the muscle, intramuscular hemorrhage due to trauma. Severe trauma causing intramuscular hemorrhage may cause the fibroblast and to change in the between the muscle fibers to change into chondroblast or even to osteoblast and forming some bone or some cartilage within the muscle. And we call this myositis ossificans. In fact, this myositis ossificans does not represent a type of adaptation, but it is more a type of cell injury. So it is not a better example. It is not a good example for adaptation. It may be an example of cell injury. Something called myeloid metaplasia. Myeloid metaplasia means the formation of hemopiotic tissue within the liver, spleen, or lymph nodes. This occurs for unknown causes, but we know that it occurs in the liver because sometimes we see it in the liver because the liver during intrauterine life is the place where the hemopiotic tissue is formed. The blood formed of hemopiotic tissue formed normally in the liver in the intrauterine life. But sometimes we may see hemopiotic elements in the liver, spleen, or lymph node in the childhood or adult state for unknown causes. Mechanisms of metaplasia. Metaplasia doesn't mean that an adult cell will transform into adult cell. No, it will be replaced by another adult cell, or a differentiated cell will be replaced by another differentiated cell. This comes from the stem cell. This means that it will be reprogramming of the stem cells that is known to exist in the normal tissue, or the undifferentiated mesenchymal cells present in the connective tissue will be reprogrammed to pass along a new pathway. So it is reprogramming of stem cells that are known to exist in normal tissues, or of the undifferentiated mesenchymal cells present in connective tissue. In a metaplastic change, these precursor cells will differentiate along a new pathway. This means that the stem cell will form squamous cell instead of columnar, or it will form squamous cell instead of transitional. So it is a case of reprogramming, not transformation of an adult cell to adult cell. No, it is the replacement of adult cell by another adult cell. Replacement through the reprogramming of stem cell. Thank you.